Good day everyone, I am Cendrick Abenoja from BSN 212H, Group 29. So today, I am going to perform the adult CPR and AED skills, so let's start. First procedure is upon arriving at the scene, scan the environment if there are any hazard present so we can avoid getting injured that can prevent us from helping assisting the patient. So then after that, shout for help. Help! Help! Everyone help! We got unconscious patient. Then check for the pulse breathing. Also check for the level of consciousness and responsiveness by tapping the shoulder and asking for if she is okay. Ma'am, are you okay? Hello, ma'am, are you okay? Next is, after that, activate the emergency response system by telling the bystander to call 911. So, sir, call 911 immediately because we have the patient's need and she needs help. Now, do the compression. So, place the hand of the lower half of the sternum, interlock the fingers. Next is, start the 30 compressions in no less than 15 or no more than 18 seconds. Compress at least 2 inches and make sure that to have this complete and equal after compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then, immediately give 2 breaths with the barrier device. I am going to cover the patient's mouth and nose with it. And head tilt and chin lift. Open the patient's airway. So give each breath over 1 second and make sure that there are visible chest rise with each barriers. After that, resume the 30 chest compression and 2 breaths in less than 10 seconds until the emergency responder arrives. Take over. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So now, for the AED or the automated external defibrillator, let's say I am the second responder and I will provide an electric shock to help the heart reestablish an effective rhythm. First is to power the AED and quickly scan the patient's chest. If the patient's chest is hairy, well, have quickly trim the areas in which the patient patch of the AED will go because hair will act as a barrier and then AED might not able to deliver the shots. Second is, attach the pad correctly. Place on one just below the clavicle on the right of the patient and another beneath the armpit just below the nipple line. Now, the AED will analyze the heart rhythm and it will tell us to stop doing CPR or touching the patients because it will deliver an electric shock. Now, clear to safe deliver a shock. Everybody clear! Now, deliver a shock, delivering shock in 3, 2, 1. Then shock delivered. After that, the AED will tell us to resume 30 chest compression and 2 rescue breaths. Or how many cycles? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After that, it will reanalyze again and it will deliver shock. So we will continue to do that until the AED tells us to stop or when the patient has been revived. Then also remember to switch role every 2 minutes or after 5 cycles since it is exhausting to do the chest compression alone. Also remember practice good team dynamics because it is a key to leading efficacy and patient safety. So that's it guys. Thank you for watching. Good day everyone. I am Cendrick Abenoja from BSN 212H, Group 29. So today I am going to do the pediatric resuscitation. It involves a child or an infant who needs immediately resuscitation So basically, the procedure is just the same from the adult CPR. So the only difference is the number of the fingers and hand used during the chest compression. Just like what I did in the adult CPR, we need to check the surroundings to make sure that the scene is safe. Next is check the patient's level of consciousness, and if the patient is not responding, we will need to do is the emergency response system. Baby, baby, can you hear me? Baby, baby, are you okay? So I am going to call the emergency response system. Sir, in a blue shirt, can you please call 911 immediately because we have the patient here and she needs immediately care. So after that, check the patient's ABC, the airway, breathing, and circulation. So now we need to open the patient's airway. So if the patient's wearing constrictive clothes, we need to loosen up and we can do the head tilt chin lift, okay? Next is we need to check the patient's breathing using the look, listen, and feel method. Look for the chest and rise and fall. Listen for breathing sounds and feel the respiration of the air. So counting 1 to 10. So if the patient is not breathing, I'm going to give the patient 2 rescue breaths using the face mask. Cover the patient's mouth and nose, but it delivers 2 rescue breaths. After doing that, check again the pulse and breathing of the patients. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Still, the patient has no breathing and pulse, so I am going to proceed with doing the cardiopulmonary resuscitation. So my patients here is infant. Infant are within the range of 1 month to 1 year old. So in order to deliver the chest compression, we will have to use the 2 to 3 fingers and now locate the lower breastbone of the patients just below the nipple and then start giving the chest compression at the rate of 100 to 120 compression per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After doing that, immediately give the patients 2 rescue breaths. So now, we will have to do the compression and rescue breaths until the rescuer arrives to take over. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'll give 2 breaths. And in doing this, make sure that the chest compression there is complete chest recoil, and then the depth of compression is only 1 to 1.5 inches because we don't want to fracture the baby's bone. And also for rescuer breaths, we should be a visible visible chest rise. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30. And I'm going to give 2 breaths. And now let's proceed to the child. If our patient is child, it is within the age range of 1 year to 8 year old. We'll have to perform the chest compression using one hand. Place the heel of the hand still at the lower half of the breastbone and then give the patient's 30 compression and 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Still, the depth of the chest compression should be at 1 to 1.5 inches and then give the patient's rescue breath. So I'm going to give patient's rescue breath. After doing that, continue doing the cardiopulmonary resuscitation for at least 5 cycles, and then the patient's for signs of return of circulation. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. If the patient has already returned of circulation, we have to place the patient in the recovery position by placing the arm that is nearest to you and the right angle, and then grab the head that is one other side, place the back of the other head on the patient's cheek, and then hold if there, and then grab the further knee and flex it, and then grasp the leg of the roll and the patient's to side. That is recovery position, and after doing that, we'll have to wait for the rescuer and document. Now for the AED or the automated external defibrillator. Let's say that I am the second responder, and it will provide electric shock to help the heart establish an effective rhythm. So first is the power of the AED, and quickly scan the patient's chest. And if the chest is hairy, we have to quickly trim an areas in which the patches of the AED will go, because the hair will act as a barrier, and then the AED might not able to deliver a shots. Then attach the pad correctly. Place on one just below the clavicle on the right of the patient, and then other beneath of the armpit, just below the nipple line. Now, the AED will analyze the heart's rhythm, and it will tell us to stop doing CPR or touching the patient, because it will deliver an electric shock. So now, for the now clear to safety delivery a shock. Everybody clear. Now deliver a shock. Delivering a shock in 3, 2, 1. Shock delivered. After that, the AED will tell us to resume 30 compression to 2 rescue breaths, or how many cycles. After that, it will reanalyze again, and it will deliver shocks. So we will continue to do the until the AED tells us to stop, or when the patient has been revived. So now I am going to do the 30 chest compression and 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And I'm going to have the 2 breaths rescue. And also remember to switch role every 2 minutes, or after every 5 cycles, since it is exhausting to do the chest compression alone. And lastly, also remember practice good team dynamics, because it is the key in leading efficacy and patient safety. So that's it for today's video. Thank you for watching.